Good morning, everybody.
Yeah, it's going.
Good morning, everybody. Remember in high school when your teacher asked you to move to the front of the room? I know we're not in high school, and I'm not a teacher, but we would, if you're comfortable, invite you to move down closer to the front of the auditorium, and we'll begin the program in just a few minutes.
It's more than a job.
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 It's a passion.
It's a calling. It's a passion.
It's helping others.
It's caring for our community.
I'm empowering people with care. I love working here at Central Health because it gives me a unique opportunity to not only take care of patients, but also optimize the system and care for them.
I'm passionate about my career and my work here at Central Health because I believe that we're improving the lives of people.
My motivation for my work comes from a core belief that every life is of equal worth.
I mean, it's very nice to have services here for my children and for myself here.
I think it's beautiful to work with people who are mission and vision aligned, and it's empowering to be in that space here with everyone that is around me, and we're really excited to transform care for our patients here in Travis County.
Central Health is different than any other job that I've worked before because of our patients, because of the culture that Central Health provides.
I like to celebrate Hispanic Heritage Month by wearing some of our traditional Hispanic pieces in a more modern way.
I think about my grandfather and my grandmother and how everything was grown on the property.
I love that I get to be part of an organization and use my nursing expertise and experience to provide increased access to care for our community.
Central Health changed the game because now, the patients that do need the help can come here and get treated.
I think Central Health's new access to specialty services is meeting the needs of our community by providing them access to the services that they have not historically had access to.
All right, so good morning and welcome everyone. Ted Virden has assigned me a very important piece of business before I get started. He said we ought to take a selfie. So for our first task here, see if I can get this done. All right, everyone, look at the camera and smile. Ready? Here we go. All right. Okay. So I hope everyone had a chance to mingle a bit, grab some delicious breakfast tacos. I tried the migas myself. Any favorites out there for tacos? Migas. All right. All right. My first migas just a few weeks ago with Ted, and I'm just so grateful to be here with all of you. I think you can feel the energy in that room as we're all gathering. And I want to just start by saying a huge thank you to everyone who was involved in creating this morning's event for all of you. In particular, Jeannie Virden and her team, Ted Virden and team. Thanks, everyone. I also want to share that this morning was designed specifically with all of you in mind. So we wanted to create an experience that you might find energizing, inspiring, help you connect with our mission, connect with each other. There's so many new people here. Hopefully you met somebody new. And then provide some information about where we're going. And so we want your feedback. So after today's event, you'll have a chance to share with us what you liked, what you want to see more or less of, and we hope to get better as we go. But we look forward to your thoughts. So the theme for today, Thriving Together, 2 decades of transformation of healthcare in Travis County. And my remarks this morning, and I think a theme that you'll hear throughout this morning, is around the roots of trust. So I want you to imagine this beautiful heritage oak, those deep roots sinking down, supporting that strong trunk of our history and where we've been and those beautiful branches reaching up to the future and where we're going. So let's talk a bit about that. As we stand at the precipice of our 20th anniversary, I think it makes sense to look back at where we've been. 20 years ago, there were some visionary leaders who came together and imagined what this could be. Helped envision Central Health. The voters of Travis County approved that process and have stood behind us year after year for the past 20 years. I want to thank the people on whose shoulders we stand and that support that's gotten us to this point. I want to also thank the CEOs who've come before me. So Trish Brown and Mike Giesland. If you look up there on the top right, we're in the Mike Giesland Community Room at Hornsby Bend. Let's give it up for Mike. We wouldn't be here without Mike's vision and leadership. We're on the precipice of where we're going next because of what he saw and the way that he led the organization over the past 7 years. I'm deeply grateful for Mike's leadership. And this particular room, if you haven't seen it at Hornsby Bend, I encourage you to go check it out. This beautiful, dignified building, decorated with artwork from the community, really sort of one of the first early steps, a visible step of who we are and where we're going. This is the year where we change the narrative around Central Health. Who we are, what we do, where we're going, how our community, how our partners, how our elected officials see us. And I think we have an incredibly bright future. The fullest potential of our mission will be on display this year and the years to follow. And there are 3 reasons I'm so optimistic about our ability to accomplish that fullest potential, and I'm going to share with you today. Reason number 1 is our people, all of you, all of us. I've had the privilege of meeting about 200 of you so far in my first month on the job, and I can share with you there hasn't been a single person who has been lukewarm about working for Central Health. We are fired up to be here. People are passionate about the mission, about each other, about our teams. You go the extra mile to have each other's back, to do the best work you possibly can. You go the extra mile for your patients, for our patients. I'm so fired up. And there's nothing that we can't accomplish with the kind of team that we have today. Just look around you. I'm so grateful to be with all of you. This is the most important reason I'm optimistic. Yeah, thank you. Reason number 2 has to do with our support, the particular way that we're supported. Many health organizations have to limit what they do based on what they can bill for and charge for or be paid for. And as we know, insurance companies don't necessarily pay for everything that our patients need. We know that deeply. We, on the other hand, have the freedom to look at our patients, listen to them, provide the whole person care they need and want to meet our patients where they are because of the kind of support that we receive from the people of Travis County. That is a huge freedom. It allows us to create some of the experiences I'll share with you in a moment and that you'll hear from others on the stage today. So that freedom to actually support the services our patients deeply need, that is the second reason why I'm optimistic. And the third reason has to do with our particular history. So as you may know, we are the only hospital district in Texas that has not run a hospital for the past 20 years. And why does that matter? Well, because once you run a hospital, something unexpected and sort of insidious happens. Even though it's a small portion of what you do, so much of the money and the revenue runs through the hospital that little by little, the priorities, the measurements, the accounting systems, primary care, for example, is most often seen as a loss leader where the expenses exceed the revenue, but we know it's just the opposite, right? That's where the value is created. The leadership, the governance, all the sort of forces begin to bend toward the hospital. If you imagine gravity sort of runs down toward the hospital, and the system assumes the hospital is the center of the care. We are different. We have worked for 20 years where the community is the center of the care. We partner, we have a public health mindset, we work through agreements and relationships and trust. We're going to bring that DNA to the work of layering on increasing layers of complexity and acuity, potentially up to the hospital level. But we'll do that in a way in which we understand that gravity points back to the community. We want to get people back to their homes, back to their families, back to their context of care as soon as we can, as safely as we can. We will design for that specifically, and you'll hear some of those ideas in the way that we've begun the work in Health Equity Plan in today's program as you listen carefully. We're going to be a different kind of hospital district, one that I believe has the potential to be truly patient-centered, whole-person care focused, high value, and allowing that gravity to pull ourselves back to the community. That could be one of our greatest strengths as we move forward. So that's reason number 3. I'm so excited. Thank you. So in the past few weeks, I've had the great privilege of visiting with some of you, and there's hopefully a lot more to come. And I want to lift up 3 stories that I've heard about in the last few weeks. As I do this, I want to acknowledge there are hundreds of these stories, I believe, that are going on all across our system. I may not have seen them, I may not speak to them today, but please know how much I appreciate you, how much I recognize the work that we're all doing. So I lift these 3 up, not to cast any shade on others, but just as an example of the beautiful things that I've seen so far that I'm so excited about. So, story number 1. This is the Northeast Health and Resource Center. For those who've met Monica D., Monica R., seen this humble, thank you. This humble portable that sits in the parking lot of a school, the moment you walk through the door, and it's a moment like walking through the magical door at Hogwarts, all of a sudden, the space is twice as large. You've got beautiful wood-paneled rooms. It feels warm and welcoming. I don't know how that magic happens, but it does. And the Monicas and their team have recognized that some of our patients, not only low income, but they may not speak English as a first language. They may not feel comfortable navigating a computer, especially filling out complicated forms on that computer. They may not feel comfortable with all the terminology of healthcare. Navigating the online enrollment process could be quite daunting and challenging. So having recognized this, the Monicas have created this beautiful process. If I'm one of those patients, I walk in to the NERC, and just on my left is a dignified little workstation. I'm greeted in my own language. I sit down at that desk. I'm put on the phone with somebody who speaks my language from the eligibility call center, and that person walks me through the whole application, is filling it out line by line for me, and then mailing this complete application to my home address with an addressed, stamped envelope. I just have to open it up, sign it, put it back in the mail to confirm my place of address, the last piece of evidence required for that MAP eligibility. Now that is a beautiful process, a deeply patient-centered process, a process that has recognized the barriers that I might face and has designed for that to make it as easy, as friendly, as dignified as possible. And I would bet that many more of our patients who are like this successfully navigate that eligibility process because of the work that the Monicas have done at NERC. And I lift that up because in all of your areas, there are likely places where when you pause and reflect, there are barriers in the way for our patients or for our team members. And I encourage you to think creatively, to think back to the fact that we don't have to bill and collect for everything that we do. How do we remove those barriers to make it as easy as possible for people to get the care that they need, knowing that actually this is the most responsible use of taxpayer dollars, because our patients will then get the care they need. They won't end up in the hospital. That'll, in the end, be much less expensive and the right thing to do and feel good for us as well. So beautiful processes like that. I want to congratulate the team at NERC and encourage us all to be on the lookout for those. Story number 2 is from our specialty services. So the first one is from podiatry. I love the fact that we stood up podiatry very early in our journey. This is a specialty that is sometimes an afterthought and comes later, but we know that for our patients with diabetes, with vascular issues, our patients experiencing homelessness, foot care is actually critically important. And so this is a relatively new service line for us. And on top of that, we just stood up x-ray services just a couple weeks ago at Capitol Plaza. And so literally that week, maybe even that day, an 86-year-old woman came in to see Dr. Brett Vessel and the team there. She had severe foot pain. Dr. Vessel was worried about infection and took an x-ray, which had just been brought online. And in that x-ray, he saw gas bubbles in the soft tissue of the foot. Now, that is a very ominous sign that reflects the potentially life-threatening infection that person had. And the team mobilized. This was late on a Friday afternoon. And so they managed to get this woman into the care that she needed right that same day. In the end, she had one toe amputated to control that infection, but just one toe. If this x-ray had been left to wait until the Monday after the weekend, she might have lost her foot or her leg or maybe her life. And so just in the moment that we stood up this service, there's at least one woman who is alive and walking on her own 2 feet, thanks to our podiatry team. So thank you for what you're doing. And the story number 3 is from palliative care. So there's a 19-year-old El Salvadorian gentleman with muscular dystrophy who unfortunately needs palliative care services, but he was reluctant to come in. Maria from our palliative care team was able to coax him to come forward and actually come in to be seen in Spanish. When he arrived, he was greeted and brought to a room that no longer looks like an exam room, but looks like a living room. It's welcoming, it's friendly, it's dignified. And as he sat there on that living room couch, Dr. Michelle Owens helped him feel comfortable and safe, allowed some of those healing silences to linger, made gentle physical contact at the appropriate times, and drew him out. And he was willing to share that actually one of his deepest wishes was to get on the internet. You know, what 19-year-old doesn't want to be on the internet? And so we made that happen. We made sure he had a phone, he got connected to the internet. We helped him get a library card so he can now begin to go and connect with his community and learn alternatives to being at home all the time. And then we heard that actually his deepest love was soccer. He was a soccer goalie, but at age 11, because of his muscular dystrophy, he could no longer play the sport that he loves. He was crying as he shared this news with our team. And so we're in the process of seeing if we can't find a way to help him go see the Austin FC as one more piece of that whole person care, meeting him where he is. As a result of that care, he agreed to be enrolled in the hospice services that he needed at the Christopher House, and he actually re-enrolled in MAP of his own accord just later that week. So how many of our patients do we know about who perhaps didn't re-enroll? And we don't know why. This is one example where somebody did, and I wanted to lift this up as an example of the kind of whole person care, things you might not normally think of as typically medical care, that really allow our patients to be seen, feel connected, feel high trust, and then choose to get the care that they really need. So a lovely example of the work that we're doing. So give it up for the palliative care team. So as we look forward, I want to paint a very broad picture of our future. So the first path of our future is really the health equity plan, which you will hear more about from my colleagues in a moment. But this plan is a direct response to a rigorous process to understand what is needed, what is missing in our community, the persistent gaps that we are stepping forward and taking full responsibility to begin to fill those gaps. So this is our North Star. It's a compass to guide our work. It is also a place where we have raised expectations. We have sort of set the bar, and we have told folks what we're going to do. So naturally, the next step is to do what we say we're going to do, to be accountable, be reliable, deliver a high quality, and one by one knock down those key dominoes, remove those gaps in care. Hornsby Bend, you saw a picture of the specialty services that I mentioned, and more to come. So that is the main road and the North Star for our work to come. I want to add to that we have the support of big brothers and sisters, other hospital districts that have gone before us. I'm thinking about Parkland Health in Dallas, Harris Health in Houston, and others who are willing to support us and show us how we can stand up this mature hospital district that serves as an anchor, that serves as sort of an orienting force within the public sector, really creating a space for the patients that we have the privilege of serving, where we are deeply trusted and we elevate that whole area, that whole half of the sky, if you will. So that's coming. And then I mentioned our history. I think we can actually build this in some ways with an even freer hand because of who we are, because of what we know, because we're going to build up from the community. I think we will innovate when we're all said and done. I believe that we will create a model that others will look to in some ways throughout Texas and maybe around the country. I'm so excited for that future. Now, I know that's a tall order, And I want to share with you that this picture, which you'll see on the wall if you come visit me at airport, is more than just a picture. We are strongest when we are one trunk, many branches. I think this is the way we achieve that bright future, the fullest potential of our mission, the one trunk, our mission, our family, that bright future, the many branches, all of us, all of you, our teams, our partners, and the way we bring that together. The trunk must be connected to the branches through deep trust, through the sense of family, by always lifting up the mission. The through line always goes back to the mission. This is where we all connect. Early in my journey, I had the chance to hear from a mentor a piece of advice that has stuck with me, and that is that optimism is a moral choice. Optimism is not always the easiest path. In fact, in the work that we do, it often is not the easiest path. But we go that way because the alternative is morally unacceptable to us. So I'll ask you, what is the alternative to us finding that place of deep trust, working together to reach the fullest potential of our mission? You know, if we spend our energy holding each other arm's length, protecting ourselves, if you will, because we're just not sure that we're there yet, and we're waiting for the other side to go first, well, then I think the future I described might be later than it could be, or it might not happen at all, and that is not acceptable. That is not why you're here. It's not why I'm here. And so what is the alternative? I am inviting you all to reflect on the question, what if we had deep trust? What if there was deep trust? How would we work together? Whether within your team, with your partners, with partners in our sister organizations. How would we do this if we had trust? And then go ahead and do it. Go first. We should go first because we can, because it's right, and because that is how we reach our fullest potential. This is the year where we change the narrative around who we are, what we do, and where we're going, and how everyone sees us. We do that by leaning into the great strength of our one trunk and many branches. We do that by asking, how would we work together if we had deep trust, and then doing it. We do that by always going back to the mission. The through line is to the mission. I am so honored and thrilled to be here with all of you. I will pledge to do all that I can to create the conditions for this one trunk, many branches to spread throughout our organization and our partners for us to reach that fullest potential of where we could go, what we could do. Thank you so much for your attention this morning. I want to go ahead and lift up two of our most important partners as I close here, Community Care and Sendero Health. Jason Fournier and Sharon Alvis, if you could join me on the stage, please. And Ted, do we have a mic by any chance? A second mic? Perfect. Thank you, Jason. Thanks. Sharon. So as you all know, Sendero and Community Care are two key partners as part of our Central Health family. In the last year, Sendero has had a banner year, enrolling more patients than our whole history. Sharon has hired a dynamic team, and this year we'll be leaning on them for a critical part of our infrastructure, what's called a third-party administrator, relying on them to do that work so that we can all reach further. I'm so excited about the future potential. So glad that you're here, Sharon. And then Community Care, together with Central Health, forms what's called a public health center. It's a partnership between the public agency and the Federal Qualified Health Center. Together, we are recognized as one of the strongest combinations of these two organizations in the whole country. Community Care's strength in primary care for 15 years, and especially through the pandemic, is broadly recognized and trusted. This is the backbone of our system, and we're so lucky to have you, Jason, with us, leading that work. I'd love to give you a chance to say a few words, and then Sharon after Jason. Thank you for being here, Jason.
Yeah, thanks so much, Dr. Lee. So good morning, all. My distinct privilege for being here. I've had the opportunity to work with Pat now for about 6 weeks. What a great find for Central Health, really. And amazing work that you guys do as our partners here at Central Health in conjunction with Community Care. We can't do what we do at Community Care without you guys having our backs, without working with us. So thanks to the senior leadership team over at Central Health, Dr. Lee, our peers over at Sendero. Pat's being very intentional when he talks about trust. And that's what we embrace over at Community Care. You can trust that our patients, our communities need and deserve us. Our patients need and deserve us. That means each and every day that we get up, we have to put forth our best effort in order for them to gain access to life-sustaining care. Not only they need and deserve, but they should have a human right to, right? Within community care, I believe within Central Health, we believe fundamentally health care and health access is a human right. Last year, in 2023, community care served about 134,000 individuals. 98% of those folks had incomes at or below 200% of the federal poverty level. 60.2% were best served in language other than English. 87% self-reported that they were from a community of color or minority background. And we can't do that without the partnership that we have with Central Health. And thanks to the taxpayers here in Travis County who have committed to funding and supporting a hospital district that goes ahead and buys into making sure folks can access that care. And so critically important, 84% or almost 113,000 of those 134,000 folks were from actually Travis County. The folks that are outside Travis County tend to be pediatric and prenatal patients because our outlying counties just simply don't have access to resources. I'd also be remiss not to mention that we're sitting in LBJ's library or across from it in the auditorium. Many of you guys probably don't know, but to Dr. Lee's point, we're a community health center in partnership with Central Health. The Community Health Center program was birthed in 1965 as part of the War on Poverty. If you haven't heard the War on Poverty, it was an initiative by President Johnson following the assassination of President Kennedy, wherein he looked across the country and realized that folks who were in poverty were suffering from many different things, one of them being access to care, educational opportunities, employment opportunities. So he wanted to go ahead and lift up and allow folks to do better. And so they made a tangible investment. Hundreds of programs started during that period. Fast forward to 1970, the city of Austin engages in a program out of that War on Poverty known as the Model Cities Program, gets a little bit of seed funding, opens up the first clinic in St. John's and another one in East Austin at 4th and Kamal. That's the East Austin Health Center, where our peers now have specialty care, you guys, over there, where we used to have the pediatric residency program. And all of this is possible because he was a visionary. And why was he a visionary? You may not know this about President Johnson, but when he was in younger years, he used to teach English to Latino and Hispanic kids in the hill country of San Marcos. And then when he came into Austin and he saw that folks were living in similar conditions, he decided to make a difference. So political stakeholders and buying into what we do each and every day is critically important to what we're doing. And so the National Health Center Program and Community Health Center Program as a whole, there's only 3 programs around today that were part of the War on Poverty that started back in the 1960s. Community health centers, bipartisan support always, because we demonstrate good outcomes. And we are, to Dr. Lee's point, one of the largest and one of the best public centers in the country. And there's only about 60 of us that are unique like this, where there's a governmental and a private entity, nonprofit partnership. But there's 1,400 of us across the country and 15,000 communities serving about 31.5 million individuals. And then you couple that to the fact that the other 2 programs you guys probably know, Head Start, Early Childhood Education, is still around. That started in the 60s. And then WIC, and we partner with the Women, Infant, Children's Program. So a lot of partnerships, to Dr. Lee's point. The way we do this and do well by the communities we serve is by partnering. And we have no greater partner than Central Health. We can't do what we do without you guys. We're looking forward to partnering with Sharon a little bit more and Sendero, figure out how we can do that. But we're so happy that Central Health is stepping forward to fill voids through your health equity plan, to step up and get more specialty care in there, strengthen services relative to respite and other wraparound services, palliative care, skilled nursing facilities, and then, of course, hospital care. We're fortunate. We've got good outcomes coming into the hospital, but there's always opportunities. We have opportunities at community care to do better by our patients, so does Central Health, so do we as a community. And there's no deficit of need, unfortunately. So I probably took more time than I needed to, but first and foremost, guys, we can only do what we do because you guys commit to do it. We talk about that all the time at community care. We got 1,300 strong. We have you guys here, another 400 people total at Central Health and growing. And so things are going to get better and are getting better right now. So thanks for all you do on behalf of the communities and patients we serve.
Over to you, Sharon.
Thank you very much. Is this on? Can you guys hear me?
Yep.
All right. Thank you so much for including Sendero in this wonderful event to introduce your role and kick off your initiative. I cannot agree with you more on how you are approaching this from a sense of trust. I'd like to introduce some of my team that's here because a lot of people don't know them. I don't know where Tiara is. I know she's here in the crowd. So Tiara Thomas is our COO. Tiara, where are you? She's standing in the back. Hi, Tiara. I also have Dr. Mary Carol Jennings. She is our Chief Medical Officer, and she is here with us. Karen Ader is here. Karen is our Chief Strategy Officer, and our Chief of Staff, Natalie Russell, is with us as well. So this is the executive team for, also Ellie Badanici is not with us. She's our CFO, but she also plays a critically important role. I'd like to go back briefly to your mention of trust, Dr. Lee. And I've worked with a lot of CEOs in my career. I've been around for a while. And they all talk about ethics and integrity and really doing a great job. And trust gets countered in there. But a lot of times it's just part of the mission vision statement that nobody pays any attention to. And this gentleman has done nothing but talk about trust. Every time I've heard him speak, he has used the word trust. And I cannot tell you how critically important it is for an organization like Central Health and the whole enterprise to trust each other. We have got to come to that. So I'm going to challenge each of you in your own work environment to trust each other. That's where it starts. So if you're at a group and you're going, well, I have an idea, and I want to speak up and say it, but I don't quite trust that everybody's going to buy off on my idea. That's the trust. That's where you create it. The three of the group, the team that you're in, you have to challenge each other and trust that it's going to be okay. Yet if you suggest something and everybody goes, that's a really dumb idea, you have to be comfortable with that. And the other team shouldn't play that role. You ought to be able to challenge each other back and forth enough to trust that if everybody's idea counts. Let me tell you, there is no business more complicated than healthcare. There is no one in this room that knows all the answers or can put all the pieces together because it is highly, highly complex. And so it takes a team like this with all your diverse experiences and all of the knowledge that you bring to the table to make this work. So on behalf of Sendero, I cannot tell you how excited we are to begin working with Central Health to really build what I hope to be ultimately an integrated delivery system that fully and very functionally and very successfully serves Travis County. So thank you for including us in this. We really enjoyed being here. Thank you all.
Thank you, Sharon. Thank you, Sharon. You guys down for a selfie to close this out?
Always.
All right, can we do lights up for a moment? All right, let's come together.
Get in here, Sharon.
All right, here we go. Ready? Okay, 1, 2, 3. Thank you, everyone. Thank you for being here.
Thank you. I appreciate that. Thanks. Good morning, everyone. I would be remiss if I didn't take a moment to recognize the incredible team behind TOC. So if you're a member of TOC, please stand up so we can acknowledge you and see you. Come on, guys. Thank you. To bring to life the team's work in a mission moment, a patient story was asked of us. It's really hard to pick just one story and justly share the trauma and journey of such a patient. But just know we have seen and learned so much from so many of our patients. For example, imagine a person experiencing homelessness, living on the streets, who gets hit by a car, has multiple fractures, and is able to heal and recover in a nursing home, subsequently be able to go to a respite facility with our department partners, and eventually, months later, be able to walk out, discharge, without needing a cane or a wheelchair. Or imagine a patient with an amputation due to their diabetes. They get the support they need from our case management team, so months later or a year later, they're able to get a prosthesis and have some normalcy in their life again. Or what about the immigrant laborer who gets injured on the job and goes to the hospital suffering from those multiple injuries? While in the hospital, he gets to meet our TOC team, and he gets enrolled in MAP thanks to the program we built with our eligibility partners. This then opens all these doors for him. He's able to connect to primary care with our partners. Or finally, imagine a patient who had to go to the hospital every week on the brink of death to get emergent dialysis. And now, with dignity, they are able to go to a dialysis center 3 times a week. These are just a few of the real scenarios where we are humbly able to support our community. Sometimes we support our patients in these ways. Sometimes it doesn't work out. And oftentimes it is meeting them where they are, which means maybe they want a phone or maybe a pair of shoes, but we're happy to do it. I know I went a little off script. I told a few stories. Hopefully I don't get in trouble for that. But if I do, we have 2 Dr. Patels in the department. I'll just blame him. But I wanted to seriously share and illustrate for you some of that TOC glue that we talk about in our department and where we fill in the spaces for our patients. We're community health workers, nurses, social workers, providers, and we have the amazing operational support. Our teams are at their core driven by human kindness and the idea that human connection leads to better outcomes. We're a compassionate ear, and we are the biggest advocates we can be for our patients. We focus on providing a fresh start in the face of trauma with kindness. And we're very thankful to do this work and shape our work with each and every one of you. So thank you very much.
Good morning, everybody. My name is Monica Crowley, and I'm the Chief Strategy and Planning Officer and Senior Counsel, and I'm so excited that we can all be here together this morning. To understand how far Central Health has come in the past 20 years of its existence, we have to look far back into the history of safety net healthcare in Austin and Travis County, beyond the 1960s and 70s, way back, more than 120 years ago to the 1800s, when the Daughters of Charity came in covered wagons to Austin to provide safety net healthcare services. The place that was reserved back then for healthcare services was a hill about a mile north of the river that was specifically cited because at that time they believed that the winds that blew across that hill would blow away any of the disease-causing vapors that would otherwise afflict the population that was being served. That hill today, although we now know that illness is not caused by vapors, is the same hill where Central Health's downtown campus sits. For most of the next century, as other larger, more urban counties, like Pat noted, formed hospital districts that supported large public hospitals, the city of Austin was the primary provider of public hospital and safety net healthcare in our community. Then, in 1995, the city of Austin and the Daughters of Charity came together, with the city contracting with Seton to operate and to provide specialty care and hospital care at Brackenridge Hospital, the public hospital, and the Children's Hospital that was then on 15th Street and I-35. We come to 2004, 20 years ago, when Central Health, the hospital district in Travis County, was born, created with the approval of Travis County voters to bring balance to safety net healthcare services across our Travis County communities, supporting both hospital services and by consolidating and enhancing and really focusing on primary care services, like Jason Fournier mentioned. At this time in 2004, Central Health took on the responsibility for medical and hospital services for all residents with low incomes in Travis County, including the provision and coordination of those services. Central Health also received in 2004 resources that had previously been owned by the city and the county, including the Brackenridge and Children's Hospitals, and the city and county community clinics that existed at the time, as well as the medical access programs that were run at that time by the city of Austin and a smaller county medical access program. For Central Health's first 10 years, guided by our first CEO, Trish Young Brown, the focus was almost exclusively on developing and growing primary care, developing the public center, community health center model that Jason and Pat discussed that turned the city-county clinics into community care health centers, and convening the psychiatric services stakeholders group, working with another key partner, Integral Care, to expand access to crisis behavioral health services. Specialty and hospital care were still supported by Central Health under this model, but were primarily coordinated by our hospital partner, Seton. In 2011, the state of Texas and the federal government announced the 1115 Medicaid waiver and kicked off a period of intense learning and growth for Central Health, during which we developed new tools and brought on more colleagues to serve our population. In that year, Central Health created Sendero Health Plans to help manage transitions back and forth across coverage types and coordinating across systems of care, like particularly when moms in our population move from being in the MAP program and then become pregnant and move into the Medicaid program, and then after they deliver their baby, they move back into the MAP program. 2012 was a huge year for Central Health when we went back to the voters of Travis County, and the voters of Travis County did something that seems very strange for a state like Texas. They voted to increase their own property taxes to support the work of Central Health. This was to fund service. It was to provide funding so that we could maximize our participation in the delivery system reform incentive payment programs, which I know most of you fondly remember as DSRIP, and to support the creation and operation of the Dell Medical School at the University of Texas in support of Central Health's mission, which now in 2012, that was just a dream, and now just south of us at 15th Street, the medical school and a new teaching hospital are serving our patients. DSRIP projects began in 2013, and Central Health's learning and growth in large part during this time as a member of the Community Care Collaborative, a partnership with Ascension, which I know many of you came to Central Health at that time, began to ramp up even more as we managed and implemented the DISRIP projects with our contracted partners like Community Care, Lone Star Circle of Care and Hospice of Austin, and in serving as an anchor for a 7-county region and as a DISRIP performing provider, we learned how to measure performance and evaluate quality and outcomes in a value-based setting, coordinating across different service lines, initiatives, and providers, and measuring the effectiveness of the services we were providing through our contracted providers. Also at this time, Central Health began to turn its focus towards improving and expanding specialty care and post-acute services like skilled nursing. We developed deeper community engagement through programs that continue to grow and thrive today, like the Community Health Champions, community advisories in Eastern Travis County, and our Central Health Equity Policy Council, which works through grassroots and grass-top collective action on long-game upstream policy changes like passing an indoor anti-vaping ordinance in Austin that will keep people from experiencing bad medical conditions for many years down the road. In 2019, now under the leadership of Mike Gieslin, building on the learnings from DISRIP about managing populations and challenges in addressing specialty care needs with the tools we then had in place, Central Health created the MAP Basic program so that we could actually manage the lives of the people that had previously been in our sliding fee scale program across the entire system of care. And legislation was passed that allowed Central Health to hire doctors and directly provide healthcare services. Then, in 2020, COVID hit, and the global pandemic changed everything almost overnight. It was instantly all hands on deck, and in addition to quickly adding electronic MAP and MAP-B enrollment, Central Health came together to support community care as it stepped up to test and vaccinate our entire community, and as it very quickly shifted to offering vastly expanded virtual and telephonic services. COVID demonstrated how we can come together, working in trust as a community, collaborating with Travis County, the City of Austin, the University of Texas, Ascension, and other local hospital systems to take care of everyone. COVID also shone a spotlight on the impact of health disparities, particularly in the communities Central Health serves, and the need for Central Health to plan differently and to provide care differently to address these gaps. In 2021, Central Health received its first grant from the Episcopal Health Foundation to support an equity-focused, systems-based approach, collaborating first with our community to determine how we can provide health care for all residents of Travis County with low incomes at a sufficient scale, timeliness, and quality to reduce disparities and build healthcare equity and equality. This approach meant looking at how we might connect across all aspects of the healthcare system, identifying gaps so that we could create a comprehensive, high-functioning healthcare system. We started with the voice of the community to learn from those we serve about their needs and about barriers they face in seeking healthcare. And we also looked at data, ours and others, to see who else we should be serving, where they live, what illnesses they are experiencing, and we assessed current gaps in capacity and in where, when, and who is getting care. In 2022, the Central Health Board adopted our healthcare equity plan that Pat talked about, which truly is our first healthcare service delivery strategic plan. In 2023, Central Health completed its second major grant-supported assessment and planning effort, prioritizing how we would address the gaps and build the comprehensive system envisioned in the healthcare equity plan how, where, and when we would add services and how we would pay for them. And the board adopted our 7-year healthcare equity implementation plan. This isn't just a plan for the distant future. This is a plan that was underway even as we were building it. And we could see in the same year, 2023, that we began making good on the promises about implementation, about expansion, about doing things differently by opening a new health and wellness center in Hornsby Bend and by starting to provide services like podiatry at our East Austin clinic. This year, 2024, we are on our way, opening our first Central Health owned and operated multi-specialty clinic and continuing to implement the healthcare equity plan, all the while continuing to deeply learn from and work with our communities, stakeholders, and grassroots organizations as we determine how we actually are going to go about building out the programs and services that are coming online. And this work is now being led by our first physician CEO, Dr. Patrick Lee, Pat, who I know, it's Pat. So sometimes you want to call him Dr. Lee, but I appreciate that intentionality of being Pat, being here with us, building that trust and connection from the very beginning. Although Pat very humbly meets us all where we are, I would like to recognize the deep experience, the deep knowledge, the deep kind of process-based approach and intentionality, and the trust building that he is bringing to this work right off the bat. With Pat at our helm, we will be able to join together and collaborate as a team with our partners and our community to lead Central Health to continue turning our vision of a mature, comprehensive healthcare system grounded in and always focused on improving healthcare equity into reality. Thank you.
Good morning. Good morning. Thank you. I have been so excited and really couldn't wait for this moment. This really serves as an opportunity to tell your stories, to really celebrate your successes in our environment. John and I really wanted to present together. Actually, I didn't give him a choice. I think we serve as each other's emotional support. As Monica alluded to, when we started considering the practice of medicine, we really looked at areas of a kind of moderate and critical or significant need. If there's an area of moderate need, it means we were meeting about 70% of the community need. If there was a significant need, it means we were meeting less than 50%. So as we speak through various services, you'll notice that those are going to be our focus areas. In addition to those focus areas, we needed to connect patients to those services and hold their hands. And I think Dr. Patel did such an amazing job in speaking to that. So the build was not only focused on moderate and significant areas, but also on connecting patients to those areas. We've spoken to this graphic many times, right? This is our illustration of potential components of a high-functioning healthcare system. If the system were to work, these components would interlace. One turns, they all turn, and patients transition smoothly through our system. And we are obviously focusing on various components that sit within this graphic. I actually wanted to focus on the white space and on the connections between them. And to speak Pat's language, the one trunk, many branches. In order to practice medicine, we had to establish a medical executive board. We had to roll out an electronic health record system. We had to establish policies, procedures, and protocols. We had to depend on a rapidly advancing legal infrastructure, HR infrastructure, financial infrastructure, data and analytic team, departments like education and research, which are working in collaboration with our HR team members on building a workforce that we know we're going to need. Many times we don't speak and point to those individuals, thanking them and looking at the importance of the build that is critical to our success, and that's why we wanted to show this graphic. So thank you to all of those folks that sit in the white space and really make the realization of the practice of medicine a reality. Now, we did start to practice medicine in our respite environment, and I'll speak to that in just a little bit. But our first in-clinic presence was at the East Clinic, where we established podiatric services, GI services, pulmonary services, and access to dietitians. And that was last October. After just a few months, we had outgrown East and therefore needed to move to Capitol Plaza. So picked up and moved our pulmonary providers and team, our GI providers and team, and we thank you all for your patience. And East has become a podiatric center of excellence where we've got podiatric care, wound care, and diagnostics in that clinic. We also want to thank our communications department for letting us put a graph up. See, I mean, we told Ted that this would be the high point of excitement, and obviously we were right. Thank you. All right, now let me explain the graph. So this is important, and really data and analytics, I just have to give a shout out again because they do a lot of great work and are never in front of us claiming the credit. So thank you for all the work you put into all of it you do. So this illustrates clinical encounters, right? And it illustrates clinical encounters in a moment in time. So that vertical line represents the end of February when this snapshot was taken. So if we looked at encounters today, the numbers would be higher because more encounters have been booked, okay? What is really important to really notice is that there are 7 lines on this graph that are all different lines of specialty service. And actually, there's more than that because respite, SNF work, transitions of care, some of our case management service lines are not represented here, and I'll speak to them in just a bit. In addition, there's a multidisciplinary line that really represents kind of our dietitians, our pharmacy presence, and some diagnostics. It is not rational or normal to stand up this many lines of service at the same time, right? So kudos to you all for doing this. We sure do appreciate the effort. We know that you carry heavy loads, and we speak daily as to how grateful we are for the work that you do. You can see there's a dip in the GI line from October into November and December, and that's because we diversified. So our GI provider that was seeing patients in clinic transitioned more to some diagnostics, and then we added hepatology, right? So that's what that is. And then you can see that we started with infectious disease and palliative care, and so those lines are relatively short. Our specialty services And let me just go one slide in advance. So we've seen since October, we've seen a little over 1,100 patients. Think about the downstream upper endoscopies, colonoscopies, PFTs, weight-bearing x-rays, and other diagnostics that our patients now have increased access to. It's absolutely amazing. So kudos to you all again for the work that you are doing. What I really want to share with great excitement is around the corner is neurology, cardiology, optimization, surgical and medical optimization, surgical specialties, and cardiology. John, did I say it twice? All right, cardiology is really important. John also stands up here so he can catch all the things that I missed. Basically, there is a ton of work that you all have already done, and on the slate up ahead, a lot more to do. So really exciting, increased access for our patients. This is a weird slide to put up there, right? But what we really wanted to celebrate is, for my chart is the portal, is the patient portal that patients can log into. The more that our patients activate their patient portal, the more we can empower them to really take charge of their own health care. When I worked previously in Arizona, I worked very closely with the chief medical informatics officer, and he had his own clinic. His activation percentage was 24%, right? And he was the CMIO of a hospital system. Our activation percentage is at 70, right? So again, kudos to you all. We know that our N is still relatively small, right? That our patient number is small, but we are thankful for our community health workers, for our front office and back office staff who are engaging and educating patients in the utilization of MyChart, because again, the more that they can lean into their care team in an asynchronous manner, the better that we can help take care of them jointly. Our no-show rate for specialty right now is at 14.3%, which is incredibly good. So a shout out to our navigation center. It means that not only are they making appointments when patients can attend, but they're connecting them to transportation, to eligibility, and removing any other barrier that impedes them from being in our clinic. Great work. Transitions of care. Hemali touched so eloquently on the transitions of care. Inpatient, ED, and skilled nursing work has really progressed by leaps and bounds over the past, I guess, year and a bit. As Hemali said, we now have community health workers, nurses, and social workers in the Seton hospitals, and are even partnering with St. David's to connect patients to downstream healthcare. Warm handoffs from the hospital to primary care partners, from the hospital to skilled nursing facilities, and from the hospital to respite. Much, much better patient care is being engaged in. In November of last year, we also started caring for our own patients in skilled nursing facilities, 3 to be specific. We have the possibility of caring for up to 15 patients in each one of those facilities. And if anybody is interested in spending time with that team to really learn about the amazing work that they do on a daily basis, it's awe-inspiring. Before they were in-house and seeing our patient may be admitted to a skilled nursing facility and rounded on by a provider within 7 days. So think about how advanced and how complex our patients are, not seeing any kind of provider or being on any care plane for the first week that you sit within that skilled nursing facility. Now they're rounded on within 48 hours and see a provider every 2 days. They also do multidisciplinary rounds with the skilled nursing facility. And if you see the skilled nursing facilities now versus when they first stepped inside, they have lifted the care throughout each of those 3 skilled nursing facilities in which they invest their time. So really amazing work. Case management was the clinical department here within Central Health before there was a clinical department here within Central Health. And what we have to celebrate is that their scope and their diversity has increased over the past two and a bit years. We used to be reactive to patients that were admitted to the hospital. They were admitted to the hospital, and then we took them onto our teams and case managed them. Now we proactively enroll patients. So Veronica, Andrea, and the team actually look at the data and reach out to patients who have touched the system many times in order to empanel them, to keep them healthy and avoid them going into the hospital. We also have a surveillance arm. So once a patient has been stabilized, they then transition that patient to the surveillance arm, which is a less frequent touch kind of environment, so that we can then empanel the more critical patients within that complex care management while monitoring the patients who are at risk for being kicked back to complex care in order to stabilize them again. The system is relatively new. It's working beautifully. And as with every aspect of our care, we're investigating in-home monitoring and some of the more remote systems that really can help tuck our patients. Hemali spoke to our dialysis initiatives. Before 2022, any of our patients who had end-stage renal disease and were starting to have system shutdown went to the emergency room for what we call compassionate dialysis, right? That's horrific. That's a horrific way to care for an individual. You know, think about it when their lungs are starting to flood with fluid, when their heart is starting to have arrhythmias and their systems are shutting down. We then dialyze them and we street them again, right? Since 2022, we have over 100 people enrolled in that predictable dialysis program, which is absolutely amazing. The opportunity now is which patients are appropriate for peritoneal dialysis, so to be able to be dialyzed where they live, and then how do we actually work with patients to get them transplants instead of dialysis for those who qualify. We think about 5 patients have received a transplant. We still need to do that research. We'll share that information with you, when we have certified that. But these are life-changing processes, systems, and an infrastructure that's being set up. This is actually the gentleman that Hemali spoke to. So this is Mr. P, who's 65 years old and was unhoused for about 15 years, who was then housed in the Community First Village. Our respite program originated under the guidance of Dr. Audrey Kwong about a year and a half ago. We started with 5 beds. We're now at 30 beds. If we think about respite as a care continuum, where on the left side of that care continuum, we're housing individuals and case managing them so that they have a safe, clean environment to heal. And on the right side of that care continuum, we would consider more skilled nursing facility care. We started with 5 beds on the left side of that care continuum. We're now at 30 beds, and we have transitioned from kind of phase 1 to phase 2, which is med rec and wound care, blood pressure monitoring, to moving into that phase 3 environment, which is moderate complex care management within respite. One of the challenges that happens within our respite environment is our patients get administratively discharged pretty frequently. Anywhere from 30 to 50% of our patients get administratively discharged. What that means is they get asked to leave. And they get asked to leave because they have complex histories. Anywhere between 60 and 80% of them have an addiction disorder. And so they're not going to be clean on the first admit to respite. And we need to be creative as to how we manage those individuals in order to increase chances for success, not kick them out anytime they stay out too long. It is therefore, it's for that reason that Central Health purchased 3 buildings off of Cameron Road, and Stephanie is going to speak more to those buildings. We are going to build a 50-bed respite environment in order to be able to design the care to our patients that they that they deserve. In that environment, we will have PT, we will have OT, we will have some form of addiction services, we will have complex care services whereby we bring specialty care to them, and much, much more. And the last service that I wanted to touch on is a bridge team that we will be working on. And a bridge team is a complex care team comprised really of similar teams that Hemali and Audrey have already put together with provider, social worker, MA, and nurse. And that team will cater to individuals who, in a budding partnership with EMS gets called frequently for patients that don't necessarily need to be transported to the ED. These patients will now potentially be transported to a clinic held by Central Health. There are patients with an addiction disorder that will have a 90-day housing stay. This is an opportunity for the bridge team to care for those individuals. There are some permanent supportive housing environments where when a patient gets to this environment, they're not yet engaged with their primary care home, and so we have an opportunity for this bridge team to care for them there. And then for justice-involved individuals, some aspect of kind of jail health, we are building an environment where we can administer care for those patients. And lastly, before I turn it over to John, one additional service that will be up and running very soon that I just thought of is psychiatric care. So behavioral health under the leadership of Kat has already kicked off, and Dr. Ashley Trust will be joining us at the beginning of May from UT, and she will kick off our psychiatric department. As I hand it off to John, a few of us just completed a visit to Phoenix, where we toured one of their respite or multiple respite environments, and there was a patient poem that was posted on the wall. Actually, Pat took a picture of it, and if you ever travel with Pat, he takes pictures of everything, right? So just a warning, and then post them. The name of the poem was called My Prayer, and it was unsigned. In the last paragraph, it stated, yesterday has passed, tomorrow is too far away, my commitment to today is to do good. And when I read that, and I was viewing Pat's pictures yesterday, I was thinking about you all and the good that you do today, and the good that you do tomorrow, and the good that you do next week is exactly what we're celebrating today. We're taking a step back and we're looking at the past year, and those good days put together have created this and the opportunity for our patients. So thank you for the good work that you're doing, and I will hand this off to Mr. Morgan.
Good morning. Can y'all hear me okay? Great. It's hard to get a word in, so. And he missed my cue where I was supposed to walk over and grab the clicker. So, no, in all seriousness, just amazing work that's happened in clinical operations over the past year. I'd like to just take a moment to recognize our clinical and operations teams that are working in these different service areas. If you would stand up and just be recognized and hopefully get a little stretch in. If you're a physician, one of our APPs, one of our pharmacists, nurses, medical assistants, social workers, community health workers, operators supporting these environments, and administrative folks in these clinical teams, if you'd stand up and just please be recognized for a moment. Now we know who's sitting in the back, so thank you for that. I remember when this entire team could fit in one restaurant too, so it's just really kind of awe-inspiring to stand up here and see how much we've grown over the past couple of years. And in addition to all of our work in the clinical environment and really focusing on building direct practice this year, we continue to reach more and more people every year in our mission. So just over the past year, we've had 112,000 individuals accessing our programs. That's about 52,000 people in the medical access program in the past 12 months, about 76,000 in MAP Basic, and more recently, an additional 2,000 who are in one of the premium assistance programs in partnership with Sendero, where we are enrolling folks into an insurance product and paying all or a portion of their deductibles, their premiums, and their copays. So how do we do that? Every month, our amazing eligibility team processes close to 5,000 applications each month. The most frequent version of that is our online application that didn't actually exist before the pandemic. So a huge undertaking for our team. I think our second most common way that individuals access our programs are through our community partners, like here at Community Care, where our community partners are assisting patients with eligibility, and then those applications are flowing through to our team. We also have a substantial number of enrollments that are happening through a telephone-assisted appointment or face-to-face appointments. And just in the past year, our team has really worked to develop virtual enrollment options that we're using for special populations, for individuals who are inpatient at the hospital, people transitioning out of the hospital and into our skilled nursing environments. We're using that service for individuals experiencing homelessness at CareCo with Community Care again. And we're hoping to use that same technology to reach others that have been a lot harder to reach through more traditional methods. Hopefully later this year we can turn that same service on for individuals who are incarcerated or coming out of the jail system. If you're part of our eligibility team, if you would please stand and be recognized. Thank you for what you're doing. So over the course of this past year, in addition to standing up the clinical environments, in addition to day-to-day business, in addition to building out an electronic health record system, we also established a navigation center for the organization. We built on the years of experience and the incredible efficiencies of our MAP call center, our eligibility call center at Central Health, and we added a half a dozen or so different functions. We have patient scheduling and registration, a very robust referral management service, both into and out of our direct practice environments. We have in-house nurse triage functionality as well as an after-hours nurse triage. We have transportation assistance to help our patients access services and access other healthcare needs as part of their journey. And also importantly, a patient experience and patient advocacy function so that we can help assist our members in that form. So of these 12,000 calls, about 7,000 or 8,000 each month are consistent with our historical volumes for eligibility purposes. But it's really important to note that 4,000 or 5,000 of those calls are brand new, and they started back in October as we turned on the navigation center function. So almost overnight, we experienced about a 50% increase in the call center volume, and we're going to have to continue to scale this as we bring on additional clinical services going forward. If you're part of our navigation center, please stand up and get in a good stretch, be recognized. Okay, so what's next? Alan talked a little bit about the next steps related to our transitions of care and our medical respite environments. I'm going to speak a little bit, very briefly, just 2 slides on specialty care. So one of our organizational top priorities is operationalizing multi-specialty care for our patients. And over the course of this year, we've gone through a few transitional steps in order to get to the Rosewood Zaragoza Multi-Specialty Clinic. And I think we're better for it. So now as we start to operationalize the Rosewood Zaragoza site, we won't be on our first clinical go live, we'll be on our third site. And I know some of you have felt that pain over the course of the year. But as we transition, we expect to leave podiatry and wound care at East Austin and really have that be a hub or a center of excellence for those services. Most of the services at Capitol Plaza will transition to Rosewood Zaragoza in the coming months as renovations are finalized. But we're really looking forward to having this space and having dedicated capacity, really comprehensive care, and ultimately right-sizing these different specialties for our patients. So it's an exciting time, and we're going to be able to really serve our patients well through these facility developments. I should also mention that we're working with community care to transition certain specialties over the coming months. Other specialties will remain at community care, and we'll continue to have an embedded primary care presence. We're also working with our partners at the Dell Medical School, at Ascension, and at Austin Community College so that we can welcome students of all kinds and really treat these as both research and teaching environments going forward. So we'll have MA students, we'll have nursing students, medical students, residents, subspecialty fellows, all rotating throughout these sites. And then, just around the corner, we have our Hancock facility. You all probably know it as the old Sears building on I-35. It's kind of hard to miss. But a significant expansion of clinical services starting in 2026 or FY26. That sounds like it's kind of far away, but it's really within the next 2 years that we hope to be operating services out of the Hancock Center. There's another location called the Clinical Education Center that I think Stephanie's going to speak to momentarily. But similar to how we've used Capitol Plaza as a bridge site to Rosewood Zaragoza, we're looking at options for the CEC to serve as a bridge site to the Hancock facility or to the Cameron Road campus. But here, it's really going to be a substantial hub of services in partnership with community care. There will be both community care and central health operated services. We'll have primary care, women's health, convenient care, dental services, HIV services, a large multi-specialty practice, diagnostics, infusions, pharmacy, lab, all on site. So really looking forward to that development and certainly appreciative of all the team members who have contributed to that development going forward. So that ends our portion of this, but really wanted to say thank you to all of you. None of the work that Dr. Schalscha or I spoke to would be possible without the people in the room. We really appreciate everybody's efforts.
Today starts with Jesus. And Camilla, thank you for the accent. It is Jesus, not Jesus. Although he does a lot for us, Jesus is the heart of Central Health. He is the first person that our patients, our community members who look for help when they walk into the Southeast Health and Wellness Center see. Jesus greets them. He asks them if they need help. He frequently directs them over to community care for their medical appointment. But a lot of times, he listens, and what he hears is they need something else. And what they need is a helping hand. They need someone who can give them some options. And then Jesus guides them over to our community resource associates, Sonia and Betsy. Sonia and Betsy, they listen for what that patient needs. And sometimes it's challenging because the patient doesn't know. But if the patient needs coverage for medical care, they'll talk to them about options. They'll schedule appointments with the community care financial screeners or with MAP. Or if they really need Medicaid or CHIP perinatal, they'll make an appointment with one of our partners for that eligibility appointment. But if what they really need is something else, maybe they need food assistance, maybe they need housing assistance, maybe they need some other social support service, they'll work with our community partners and schedule an appointment for TANF, for SNAP, for SOAR. Or they'll just go to find help and see if there's a community-based organization that might be able to offer some help for these patients or community members. It's important work. It's that first trusted connection to what we do here at Central Health. And we can't do it without people like Sonia and Betsy. At Rosewood Zaragoza, we have Rosa. Rosa lives in the neighborhood. She understands her community. And she sits at the Hornsby Bend Health and Wellness Center. She serves as the eyes and the ears for her community and helps people, directs them to the community care clinical appointments if they're there for that. She helps them if they just want to reserve a room. Sometimes they just want to have a meeting or a party. And we can do that for them at both of these centers. The Hornsby Bend Health and Wellness Center is really important. It is the first new ground construction Central Health that's achieved since the construction of North Central in 2011. And it's really the first construction project of many that's in our pipeline. It's an amazing place. It has the most fantastic playground, Jeff Canodal. It's an all-access playground. It's the first one that we've ever had that people of all developmental walks can come in and play. It has adult fitness if you're brave. I'm not sure how to do it, but there is signage. We can't do this work at our health and wellness centers without partners. This is Leonore. Leonore has been with Community Care and Central Health. She really brings all of these programs and these places to life. Without partners like the Central Texas Food Bank, without really trying to work on more food access programs, these would just be kind of empty places where people would just get medical treatment. Not that medical treatment isn't enough, Jason. But as we know, our patients need whole patient care. We need to meet them where they're at. And so often, what they need isn't a clinical encounter. What they need is a warm meal. This is Monica de la Cruz. There are two Monicas. Actually, there are several Monicas at each of these sites. Monica de la Cruz is the administrative supervisor for our Eastern Travis County sites. And she spent a lot of time at the Southeast Health and Wellness Center. She keeps the bills paid. She calls the codes if needed. But also, she's keeping an eye on the Del Valle Health and Wellness Center. She lives around the corner. And we hope that that site opens with clinical operations provided by Community Care and a multi-purpose room and community resource associates from Central Health at the end of this fiscal year. We talked a little bit about Monica Rodriguez. Most of you in here know Monica Rodriguez. Monica, though, is a handful of people that have been with Central Health since the beginning. She was actually with Central Health before there was Central Health. Monica comes to us from the city of Austin, and she worked for a long time with the Medical Access Program, and now she is at the Northeast Health Resource Center. What Monica does best is she brings people into care. She starts usually with diapers. Monica, I don't know how many diapers we're at, but it's like 1,000, it's several thousand every month. We have a partnership with the diaper bank, and she's able to distribute diapers and feminine hygiene products and other things for families. And then she is very persuasive. It's really hard to tell Monica no. So when the mom comes in for diapers, she'll ask, hey, do your kids have health insurance? Have you gotten a checkup? And then she'll get them enrolled in Medicaid or CHIP or MAP. Monica Rodriguez is really waiting for a permanent home in Colony Park. And last year, we closed on some property with the city of Austin in the Colony Park Master Development Area. And Michael Stone's out there somewhere. There he is. Michael is our construction project manager. He's getting Rosewood built. He's also making sure we're getting some architects. If he weren't here, he'd be getting those architects under contract for Colony Park. We're really excited about this Health and Wellness Center. We think it's a real opportunity for us to come with Community Care and our other partners to create a resource that meets all of those whole patient needs in one site. We talked a little bit about Cameron Center and some new properties, but I want to talk to you all about why we're getting these properties. We're getting these properties because we want to deliver more care directly, because this team is growing, and because we have a lot of services that we need to stand up that we've never thought about before, we've never known we've needed. So Melissa Cepeda, are you there? I think I saw you, there she is. Melissa Cepeda is our property manager. Right now, she's working to kind of just babysit these sites. These sites have tenants in them, a lot of small businesses, a lot of people without that business who might be our patients, right? So she's working to try to get this site transitions so that we can start demolition and construction for medical respite and other clinical services to really meet those patient needs that we saw earlier. The Cameron Center was acquired last year about this time, and we're really excited about the possibilities this 100,000 square feet brings to us. How many of you met Gunnar? Gunnar, I'm not sure when you started, but you were told, hey, we got to turn this building around and have it function as a specialty care clinic. By the way, December 1st is when we signed the lease for Capital Plaza. December 16th is when we had it open for first patients. A couple holidays in there. Gunnar must have been an elf over those holidays. He made sure that we had the quickest turnaround and make ready that I've ever seen. And I think he cares deeply. He's been at the clinic, hanging up pictures, fixing things. And that's one of the things that we really need to think about as we grow as an organization. What functions, what programs, what processes do we need to develop and establish in order to make these clinical sites function for our patients and for all of you? He had the vendor, no lie, re-wax the floors, I think 3 times. You'll have to ask him. This is Alex. Remember we talked about functions, new things. Well, we had to start managing all of our assets, our furniture, our medical equipment, our other pieces that occupy our spaces. Alex is our asset manager. It's a relatively new function for us. It's a good thing she's a math major. She's a degree in math from UT, because there are a lot of things to count and keep track of. Hancock. So many of you know that this is going to be a clinical space, but it's also going to be the offices and the administrative headquarters for most of us here. So we believe that Community Care Sendero and Central Health will all occupy the upper level. There'll be clinical services, John alluded to those, lower level. And then public meeting space, including where we will have board meetings for all the organizations in the lower level. We got a special carve out for our joint tech team. They have a large presence in the lower level as well. The Hancock Center is really interesting in that we're going to be co-located, and we've had to really think carefully about how that building works. And we have the wisdom and expertise of 3 people who are all PRN to us. And PRN is a term, it's Latin, right, pro re nata. It's a term that we use primarily for providers, but here at Central Health, we can make architects PRN. So we've got 3 very experienced healthcare and construction and development professionals, Alan Bell, Sean Lavin, Bill Mullane. If you ever have a minute to talk to them about their experience, a lot of the healthcare infrastructure, a lot of the higher education buildings that you see around Travis County, they had a hand in, including the Dell Children's Hospital. We're really excited about Hancock. It has a lot of challenges, but also a lot of opportunities. And we really think that it would be great if all of us could be located together in one building. This is Manning. I don't know, Manning. Manning sneaks up on you. But he is fantastic. He's relatively new to Central Health, spent over a decade with Fresenius, building dialysis centers across the country. He oversees our construction and development, all of those projects. He also is a stickler for the contract, and he makes sure that all of our general contractors are adhering and abiding by the rules. And he is a steward of the taxpayer dollar, and I'm really grateful that he is so mindful of that stewardship. And I see him in the background. There's Chris in the very back in the doorway. We had a water break over at the dental area in Southeast Health and Wellness Center this morning. Chris is busy. Chris is the Director of Facilities Management. And Chris is also an industry professional. We might have poached him from a hospital operator that we are partnered with. And he has a lot of experience with those healthcare facilities. He keeps the lights on. He keeps the doors open. He makes sure that when the pipe breaks in the middle of the night at our site, someone's there. He works with community care and the facilities team to make sure that we have all of the clinics within Central Health's purview cared for. The most important thing he does is make sure that the air conditioning is working at all the buildings, and y'all know that it is no small feat in the Texas heat. He's very experienced with the Clinical Education Center, which is the old children's hospital. I think Monica talked to you about this at the very beginning. We're bringing it back home. We're going to occupy the Clinical Education Center starting this fall. And there's a lot of opportunity there. Jeannie's got her eyes on it for the HR team. It has both the clinical education component that they've been using to train nurses and other providers throughout the community. It has clinical space. And I think for us, it's going to serve as a great transition as we stand up the practice of medicine at Central Health. And this is where you come in. All of us have a role in how these spaces are designed and how they function. If you're a clinical provider or in a clinical space, what can we design to make your workflow easier? How can we position something so you can take a few less steps every day? Or how can we make something more patient-centered within a clinic environment? Maybe you are just working in an administrative position, and not just an administrative position. We can't do this without our finance team, without our joint tech team, without all the people who keep the support operations together. How do you want to feel in a break room? Do you want a moment of kind of solitude and introspection? There are many times where I need just a break. Or do you want to sit at a communal table and gather with other team members from across the organization and have lunch? It's one of the real joys of going to the break room at airport right now. When on a Tuesday, when everyone's gathered, the other day I saw Lisa Pincos interrogating Eric Elliott, but it was fabulous to hear their conversation. Just getting to know you. What do you do? How did you get here? And I think this is really critical. All of us know something about our patients. All of us know how we want to feel when we have to go to the doctor's office. Sometimes it's really scary, right? Sometimes you're going to hear bad news. So I need to hear from you, and we need to understand what is it that we can do to make that patient experience better and uniquely Central Health. We look forward to working with you. Thank you so much.
Thank you, everybody. My name is Jeannie Virden, and I'm Enterprise Chief Human Resources Officer. I'm very excited to be here today. I want to first thank Pat for letting us, and well, not letting us, but supporting us in having this all-team meeting. I think it's very important for us to celebrate the work that we've done to date. Look at all of the work that's coming, right? Because there seems to be a few things, according to Alan and John, right? And how we are going to together get there to accomplish everything. I do want to take a minute and echo my thanks also to Madeline and my team, to Ted, his team, and everyone at the UT system who is here, who is making this possible. It's a pretty heavy lift, although it looks pretty easy. So with that, we've talked about the work. We've talked about where we're doing the work. I want to talk about who's doing the work. We've celebrated some teams here, but it's our collective uniqueness that comes together to truly make the Central Health team who we are. So we went back. We did not go back to the 1800s like Monica did, but we went a little bit back, a little further than Alan and John. If you looked at the Central Health team at the beginning of October 1st, 2018, a little over 5 years ago, we were 111 team members. We ended last fiscal year with 299, right about the time that this picture was taken. That's an incredible increase of 169%. But we have only just begun, we've only just got started. Thanks to our talent acquisition team and all of our hiring managers, the first 5 months of this fiscal year alone, we have onboarded another 131 peers and colleagues that have joined us today. Yep. That means collectively, there are 430 Central Health team members sitting here in this room and joining us online as of today. That means that that's a 25% representation of over 1,800 employees within our healthcare system right now, inclusive of community care and Sendero. Yep. Given the rapid growth that we've experienced, it's no surprise that some of us are newer in our tenure. But I do think it's noteworthy to point out that over 25% of our Central Health team has been with us for 5 years or more, either within Central Health proper or through collective service within Sendero, Community Care, and Central Health. If you're part of that 5 years plus, please stand up and let's recognize you for your commitment to our organization. So as you know, it's pretty common that healthcare teams are predominantly female, and our workforce definitely reflects that as well. However, compared to this time last year, we have seen an increase of 35% of male representation, which just shows our commitment to gender diversity. Our workforce is also generationally diverse. Millennials and Gen X make up the majority of our workforce today. Yeah, go Gen X, right? Millennials are the fastest growing population within our workforce, and we've now seen the addition of Gen Z. That means that Central Health is still going through its generational transformation. And finally, our organization takes pride in its ethnic diversity. While Hispanic or Latino representation remains the largest of our employees, there are several other ethnicity groups that have seen significant growth rates over the past couple of years. That includes those of 2 or more races, African or American, Black or African American, Asian, American Indian, or Alaskan Native. However, as you know, there's always more work that can be done. Did you know that in ADP, we support and promote support inclusive practices, so where you can add your preferred name into the system. You can add your pronouns, you can add your gender identity to your employee profile. If you haven't already, please do so. This helps us get a holistic understanding of who our workforce is, how we can better support you, okay, and ensure that that we have representation for all of our team members. I also want to take a moment to recognize Kent, our Enterprise DEI Manager. I want to thank him for his leadership in all of the DEI programming and initiatives, okay, inclusive of working with the council. Not only does he do this for Central Health and Sendero, but as of this fiscal year, community care is included in that. He works very closely with Imelda, our Enterprise DEI Specialist, as well as the chair and vice chair, Adriana and Christian, of the DEI Council to develop these programming initiatives that we bring to you. Last month, we celebrated Black History Month with one of our more innovative recognition programs through the Black Art Expo. Our creative team members here donated their art so that it could be displayed and we could recognize all of their contributions to our sorry, y'all are making me nervous. Featuring the artwork created by talented staff members from across the enterprise. These were predominantly displayed in the main lobby of our airport location, as well as virtually through the DEI page. This month, we are celebrating Women's History Month. The theme is going to be Inspire Inclusion 2024 and beyond. It is crucial to inspire others to understand and value women's inclusion, because when we feel included, there's a profound sense of belonging, relevance, and empowerment, leading to a more equitable and supportive work environment. When you leave today, as you're leaving and you're getting your special prize jackets, if you didn't know, right? The DEI Council has also set up a place where you can go and have look at words of inspiration and take pictures. So I would like to invite Kent, Imelda, Adriana, Christensen, all of the current and former DEI Leadership Council members to stand up and be recognized for everything that they've done, as well as the talented artists that had their art displayed last month. All right. Not only are we unique in the diversity and talent within our organization, but we also have a wide geographical spread. Of course, the pandemic helped shape this shift for us, but in Texas, we have gone from employees within 49 zip codes to 106, representing a 116% increase. Additionally, we have team members from 3 states that are now extended into 11, which represents 57% of our organizational growth. So, as we know, as we continue to grow and diversify across Texas and the United States, we understand the importance of establishing a wellness program. We need to identify wellness initiatives to address the diverse needs of our employee population. I would like to thank Neha, who spearheaded our very first annual wellness survey. The feedback that y'all have provided was very important to us. We had 75% participation, and the overall performance score was 70% compared to national benchmarks. The survey results showed that the work that you do is meaningful, and you have satisfaction in what you do. However, the stress levels and the burnout that each of you are experiencing is very different. We hear you, we recognize that, and we have some initiatives that we've been working on in HR to help address some of these things. Our talent development team has onboarded our very first enterprise learning and development manager. She's going to be overseeing the professional learning and development opportunities and programming for the enterprise, inclusive of leadership programs. Our total rewards team will be assessing our current benefit package to bring recommendations forward to how we can better offer more diverse benefits to our employees. This is going to be done in conjunction with DEI and employee wellness to ensure we're looking at this from a holistic approach. Our total rewards team is also going to be looking at our current rewards and recognition programming, inclusive of service excellence initiatives. They're going to work with team members and leaders to ensure that we implement initiatives that matter to you. Our talent management team is currently working with our joint tech and procurement partners on the requirements needed for an employee lifecycle engagement tool, which is going to provide us with a continuous modern-day system to provide a continuous listening platform. They're also reviewing our performance management processes and systems, bringing back recommendations, and they're going to be working with our leaders, our strategic business partners, to help solve for some of the more common workplace concerns. We in HR are also committed to working with Neha to build a wellness council. The Wellness Council will play a pivotal role in reviewing and recommending initiatives to address various areas and feedback that we've received. And last but not least, we are working with our finance and payroll partners to implement a new applicant tracking, HRIS, and payroll platform to replace ISIMS, ADP, and eTime. We don't have an official launch date as of yet, but we are very excited about where we are headed with our people capabilities and analytics. We're going to be focused on delivering a best-in-class candidate and employee experience across all stakeholder groups throughout the enterprise. Here are some of the things that you can expect from the UKG platform. The integration of HR systems into a single unified platform will streamline and automate technology, processes, and data management to reduce manual processes, provide more self-service options to our employees, and provide quality and more insightful analytics for better decision-making capabilities. Once launched, we will enhance the UKG-ready platform by deploying the full suite of modules to seamlessly manage every employee experience touchpoint through the full employee lifecycle. As an integrated single source of truth for employee data, the possibilities for continuous operational improvements are endless. We look forward to better serving you as we grow in our organization, as we add more team members to be able to better support you. Thank you. Whew.
Hi everyone, happy Monday. My name is Becca Cline, and I have been with Central Health for a little over 3 years as a resource eligibility social worker. This is a niche position within the enterprise that focuses solely on supporting our most vulnerable MAP members with applying for Social Security disability benefits. Obtaining Social Security benefits not only provides crucial income for these individuals, but also makes them eligible for Medicaid and/or Medicare. I was asked to share the journey of a client that has touched many different team members throughout the healthcare delivery department and is a true success story. In July of 2023, this person was involved in a pedestrian versus motor vehicle accident where he suffered multiple fractures, a brain hemorrhage, and other trauma to his body. He was referred to our post-acute team from the hospital for skilled nursing needs such as PT, OT, and speech therapy. The post-acute team ensured that he was connected with community care and supported him with attending all of his medical appointments, managing any specialty referrals, and ensuring he had any and all durable medical equipment. While at this facility, this client was referred to the research eligibility team, where I helped him apply for Social Security disability benefits utilizing the SOAR model. This client made huge strides in the 2 months that he was at the skilled nursing facility and was able to transition from the skilled nursing facility to Fresh Start. Fresh Start is a residential rooming program that Central Health contracts with for our most vulnerable clients. This program serves as a bridge between skilled nursing and respite and provides our unhoused clients with an opportunity to further recuperate in a residential setting that is not a shelter or the streets. This allows our clients to continue to improve and get well. This is the first time in 23 years that this client had had a roof over his head outside of a hospital or skilled nursing facility. While at Fresh Start, this client engaged with our case management team. This team supported the client in navigating life after the nursing facility, such as managing his own meds, helping him to attend his appointments, support him with engaging in mental health treatment, and helping him to apply for Metro access. They also connected him with Downtown Austin Community Court for support in getting his ID, birth certificate, and to get a coordinated housing assessment. This connection has led to this client being assigned a housing case manager through Downtown Austin Community Court, who is actively supporting the client in finding permanent housing. In December 2023, the client transitioned from our case management to our surveillance team, which is less intensive and allows for more autonomy from our clients. This client has exceeded all expectations. While with surveillance, the client successfully applied for food stamps and continues to attend his medical appointments and remain engaged in his medical and mental wellness. In addition, the client has recently been approved for SSI and Medicaid, which is life-changing. This will allow the client to have the means to afford housing now and maintain his independence. The client's journey is not yet over, but we are so thrilled to have been a part of his journey for the past 7 months to support him with making such positive changes in his life. Thanks.
We can clap. I couldn't help it. Hi, everybody. I am Ted Burton, Chief Communications Officer, and this is my TED Talk. Get it? I tried. And not to be upstage in the content game, Pat, I'm getting my selfie. You all ready? Lights up just for a second. Got it. Thank you so much. It's so fun to be here and see all the amazing work that you all are doing. I get to share just something really short and really exciting. Before I do, I want to do a shout out to my dream team, the communications team. I'm surprised they're not on the front row. That's really weird. Like, what happened? Some of them are in the booth directing the show. Others are running around with microphones and trying to keep us on time, and that's sort of working. So, what's a brand? What's in a brand? When you see these logos, what do you think? Top left, of course, hook 'em horns. But when you see these logos and these brands, I assume they mean something to you. You have a feeling, an emotion, a thought, hopefully positive, maybe not. If they don't have a story, it's just a bunch of logos, right? Each one of these brands has a story, and I bet each of us could probably, in a relatively accurate way, talk about what that story is. But it's not just organizations that have brands. People have brands. Oprah has a brand. Taylor has a brand. Michelle has a brand. This guy has a brand. Brands cross the spectrum from positive, inspirational, they make you want to dance, they make you want to read, and then we have a brand. These are brands. These are the logos that make up the Central Health system. When you see these logos together, you know instantly that we're connected and part of a system of care. No, you don't. And the reason you don't is because, and I do believe each one of these logos, entities, affiliates absolutely has a brand, but together there's something missing. When they were created, they were not created together or intentionally. So we shouldn't be surprised that they don't necessarily look like they go together. A couple of years ago, as Monica mentioned, and John and Alan, Central Health and our Board of Managers adopted a new healthcare equity plan. Our goal together is to create a high-functioning, equitable, keyword, safety net healthcare system for Travis County, and that's what we're working on. Oh, I ruined it. Oh my gosh. I am fired. I should be fired immediately. So for the past 5 years, and many people in this room and almost everyone on our communications team has been working together on a branding initiative that started with an outside independent performance review that was ordered by Travis County of Central Health. It was a performance review that encompassed many parts of the organization, but one key finding related to marketing. And the finding was that there's confusion among constituents regarding the actual relationship between Central Health and its various enterprise and affiliated partners. What it means is nobody knew and or knows that we're connected, and if they did, they weren't really necessarily sure on how or why. I think I'm missing a slide, y'all. Oh my goodness. Am I hitting the wrong button, going the wrong direction? So we started doing research back in 2019. We did peer research, meaning we looked at healthcare organizations around the country and here in our own community that had been through brand evolutions like the one we knew that we were about to begin. We did an awareness survey. We did focus groups. We did in-depth interviews. I had hair back then, y'all. No, I had like full, beautiful, I got a picture later. So then something called COVID-19 happened. There was a pandemic. And this initiative came to a screeching halt, as it should be, because the entire organization had to shift its focus to responding to a pandemic and caring for our community. Then in 2023, we kicked it off again. We did new research, more peer research. We did an awareness survey. We did in-depth interviews. We did focus groups with employees of all of our affiliates. Some of you in this room, I am certain, were in those focus groups. We did focus groups with managers, non-managers. We did focus groups with the community, so with patients, people who'd received care from community care. They were or had been MAP patients. They'd received care from Central Health. We did focus groups with non-patients, folks who they're Travis County taxpayers. They live in the community. They may or may not have heard of anyone or any part of the enterprise. I'm scared to hit this button again, by the way. So after all of that and a lot of work that went into the research, beginning to explore brand possibilities and stories. And I want to give a special shout out, I think, to Jason, Tara Trower, and Sharon, who was a little bit new to the game, but enthusiastically embraced what we were doing. It's been a long journey. I'm pretty sure they're tired of hearing from me, but believe it or not, they still respond to my texts. I don't know, they don't necessarily take my calls. But we've worked together to get to this point. And so now I'm gonna do the big review. If only I had a drum roll, dang, that would be really perfect. Oh my gosh. Y'all, okay, who's doing this? Who is running my show? All right. The first question some of you are asking is like, that is the ugliest black and white logo I've ever seen. It's not gonna be black, it's not gonna be black and white, right? It's not gonna be black and white. This is just an image of the logo that I'm gonna talk about in just 1 second. But before you get lost on color, by the way, nobody has an opinion on color. Nobody. Everyone just, we're fine, we're good. I wanted burnt orange, it got killed. Nobody has an opinion. It'd be like let's paint this room. You have any ideas for colors? We'd be here till like next Thanksgiving, right? Well, that's kind of like it was for this logo development. This is the logo. I promised. And this is the logo in color. I want to talk about some of the elements because they're all very intentional. First of all, hopefully you see the colors. It's a very dark green and a mint green. That was intentional. We heard from focus groups that there are certain colors, and we know, Monica, from color science, that there are colors that mean something, right? Trust, approachable, honest. Those are found in the color green. You'll also notice, I think, in the middle is a cross. We explored that cross because we wanted to make sure that it wasn't seen as a religious symbol. And we heard loud and clear from our focus groups that the cross is instantly recognized as a healthcare cross. If you need care immediately and you see a cross, you probably know that that organization, that building, that group is going to provide healthcare. You may or may not see an H. An H also stands for hospital. We are a hospital system. It also stands for health. And this is the one that people don't see until they look at it a little bit like the Where's Waldo. There's also a C. Raise your hand if you see the C, don't lie. Oh, it worked. I'm so happy. So yeah, so there's a C, there's a H, there's a cross. Notice that the affiliates are keeping their name. So Community Care's not changing their name. Sendero's not changing their name. We did add a tagline for Central Health, which is Travis County Hospital District. If you've ever had to speak to the media, talk to a partner, advocate, community member, do you ever find yourself saying Central Health, the Travis County Hospital District? So let's make it easier on people, right? Let's get rid of the guessing game. I didn't hear that. Hospital District, Travis County Hospital District. So a little bit about, it's not gonna be just green and mint green. And by the way, some of you are probably saying, that looks navy blue. I think the same thing, but it really is not. It's green. But at the glance, you can see there's a unified single or two colors that bring the logos, the system affiliates together. You can see at the top, and I'm going to show you this in a second, there's actually a color palette, right? So we're not going to just use green and light green and that's it. There's a whole palette of colors that I'll talk about. But the choice of the greens was intentional. We did not ask focus groups to tell us what colors they wanted, but we had a conversation. And these are the things that we heard from consumers, patients, et cetera. And we built the color palette. Thank you to my amazing creative team, Diana and Camilla, and our partners at Belmont Ice House. But this color palette was built with ownability in mind. So I can show you slides of the affiliates kind of in market against what you might consider our competitors or partners, and it stands out. We didn't want to be confused with other healthcare organizations or entities in the market. This is the entire palette. You'll notice on the left, it's what we have called the legacy orange for community care. This remains a primary accent color. So even though you might not see that orange in the logo, you will see it, and I'm sure community care will use it in many other platforms and channels. For example, this could be a website. This could be a fact sheet brochure, but you can just see how all the colors come together, the greens, the light greens, blue, and that prominent, really visible legacy orange. Not burnt orange, by the way. We can have that discussion. Here's some other examples, different channels, different platforms, right? So top left, website. Top right, maybe it's an advertisement in a magazine. Look on your mobile device. Oh, and look, there's my business card. That's weird. Not really. Yeah, so quickly on the timeline, what happens next? Probably you're wondering, oh my gosh, am I getting new business cards? Am I getting new shirts? Am I getting new, your mind is racing. We get it. We actually have a plan, a very large plan, bold plan on how we implement this brand. This is not the launch of the brand. This is a sneak peek preview with a really bad PowerPoint operator. So this is not the actual beginning, but it is the sneak preview, and I think you'll have an Oprah moment later, as Jeannie said, where you're going to walk away with some swag. But today is the preview. The brand development continues. There's a lot to consider, and it's going to be a phased approach. So think about the digital side first, right? So the website, digital platforms, advertising. Then you can think about anywhere you see our logo or brand, that will have to change at some point. It cannot happen overnight. So Stephanie has promised that tonight she's going to be going to all of our locations and starting to change out the signage, right, Stephanie? Was that tonight? Okay. But when we open new clinics, we would open a new clinic with the new brand, right? We wouldn't want to put the old signage on a new building, right, Stephanie? Is that how it works? Well, okay, we're going to have debate about it. I'm kidding. So the brand launches in May. Did y'all remember May is our actual 20th anniversary? It'll be the 20th anniversary of the election that created Central Health. So we're looking at that as our kind of official anniversary of the organization. There's a lot more to come on that regarding just public-facing community celebrations and events. And then the implementation, I estimate, will take 2 to 3 years. So it is not going to happen overnight. So you're not going to turn in your uniforms, your scrubs, outside and get a new outfit today. Although that would be beautiful, but it's not going to happen. It's going to take a while. And vitally important is you are all going to be part of this brand implementation. You are the ambassadors of Central Health. And so we are going to arm you with the messaging, the why are we doing this? And so if somebody asks you I like the old logo, John Morgan, you can say, well, do you know there's a reason that we're doing this? We are part of a system. And so we want to make sure that you have the information, the knowledge that it's authentic, and then you can begin to tell colleagues, partners, community advocates, husbands, wives, spouses, exes, whatever you want to do. You can let them know what we're doing. Now I'd like to invite up one of my colleagues for our final mission moment. And then, believe it or not, it's going to be your opportunity to ask questions of any of the presenters that presented this morning. If things that we didn't cover, things that we missed, it's going to be your chance. But first, where is Aida? There she is.
Hi, my name is Aida, Cerda-Prezak, and I'm the Community Outreach Supervisor for Central Health. I'm here to share with you my Central Health mission moment. We community health workers are always on the job. Even when we're not on the clock, we're working. I belong to the St. Vincent de Paul Society at my church. People reach out to us to get help with rent, utilities, food, and other needs. In January, we did a home visit with a gentleman who had fled Venezuela due to political persecution. At home visits, I always ask if the person has health coverage. This gentleman did not. Not only that, but he was also an amputee. He and some friends traveled to the U.S. by way of Mexico, and when they were in Mexico, they were robbed by the cartels. There was a struggle, and this person was pushed onto the railroad tracks. He was not able to get away fast enough and was run over by the train and lost his foot. The injury got infected, and doctors amputated his leg just below the knee. Even then, after he recovered, he was able to make it to Austin, where I met him. We helped him with an online map application and even got him an enhanced library card, which he can use as ID. We were able to get him some food from a food pantry, a space heater, bus passes, and a hands-free crutch and insulated backpack that were donated by a generous community member. We always advise our MAP patients to make that first appointment to establish care. He was having trouble getting an appointment, so I referred him to the Black Men's Health Clinic, where he was able to get an appointment within 2 weeks. He established care and got a referral to the Hanger Clinic, where he will be fitted with a prosthetic leg within a week. He will then be able to walk without assistance, which will not only improve his quality of life, but it will open up job opportunities. This was all due to having MAP. He is so grateful for all that Central Health and MAP have done for him in a very short amount of time. And he signed up for our new Accelerated Community Health Champions class in the Runberg area, and he can't wait to be an ambassador for health in our community. This is my mission moment. And it's why I'm so passionate about the work I do, even when I'm not on the job.
The presenters back on stage. Not quite yet. We're going to invite the presenters back on stage. This is your chance to ask questions. We have 2 handheld mics. I know some of you love a mic, but we're not singing karaoke yet. We might later. But please, if you have a question, I think it's Yvonne. Yeah, Yvonne and Yesenia are going to be available. Just raise your hand, and they'll bring a mic to you if you don't mind standing up and asking your question. Can we get the house lights on also? And do we have a question? Here we go. Can we turn up the house lights also, please? Thank you.
Hi. Oh. Hi, I'm Esmeralda Mireles Monroe, and I manage the Joint Tech PMO and IT training team. This is them. But before asking my question, I actually wanted to say thank you to the Joint Technology team because, yeah, everything that was presented today, we have a specific tie to it, technologically, ITIS, anything having to do with collaborations or trying to help kind of go overnight remote with COVID or trying to set up a new Epic EHR system to just partnering with you. So my question to y'all is, we've heard about what we need to be ready for, right? What's coming down the pipeline, which is wonderful. And I know that we're getting a lot of that inspiration about who we're going to be helping and why. But as direct employees of the Central Health Enterprise, what kind of advice would you give us to prepare for that as well, kind of on an individually day-to-day basis?
I'm happy to kick that off and would welcome thoughts from the team. You know, I actually think when I meet with y'all, naturally we visit, that energy and passion that you have for the work you're doing today. I forget who said it. Maybe Sharon said it. Others mentioned it. The work you do today, the way that we treat each other, the way that we listen to each other, we give space, we take space, and we always focus on our patients, we focus on our customers. Sometimes the person we're serving is someone else on the team. It's that person-to-person stuff, the culture, which is really how we do things around here or how we do things every day. That is actually the most important thing we need to do. If we stick to that, actually, Alan, you mentioned it, right? It's the day-to-day that adds up, even in the few months we've been doing direct care, to where we are at this moment, and will add up to that beautiful future. It's helpful to know where we're going, and I think that helps pull us forward, and we will do the work to help you be able to see in various ways, in stories, and in data and numbers, and in built environment, and so on. You can see that future, but I think the focus on today, how we are with each other, how we lift up the mission, everything we do, that is easier said than done, but that is where I'd put our focus on this moment and with each other. I'm really curious to hear what my colleagues would say. It's a great question. Thank you.
Sure. Sorry. But the one thing I would say is also, if you've got questions about what we're doing, about where we're heading, about why, if you see something in a board meeting, not to call out anybody particularly, but I will. Scott Levine, thank you so much for reaching out and picking up the phone and calling me with questions after a couple of board meetings earlier this year. Please don't hesitate to reach out if you've got questions, if you've got ideas. I think that's one of the ways that we are going to make good on kind of this relational trust, is know that your questions are important, that if you've got a question, someone else probably has asked themselves that same question, and reach out to your supervisors, but also don't hesitate to do a drop by or a pop in or pick up the phone. John?
I would advise that you have a really good understanding of what recharges you. This work is hard, and I think we are our best at work whenever we do that in balance with a really healthy and productive personal and social life. So making time for that balance and making sure that you unplug outside of work so that you can show up on Monday engaged and ready to get it done.
I'd like to take a shot at the title too. First of all, I want to second Esmeralda, the shout out to Joint Tech. Perla was going to bat cleanup, so saving best to last. We truly appreciate our Joint Tech partners and would not be able to do anything without Joint Tech. I'm going to beg forgiveness, right? Because I remember even with the strategic plan, if John and I look at the whiteboards of what we thought even with strategic direction would make sense to what exists today, we didn't get everything right. So, mission is central to where we're headed, utilizing data to fill in kind of the sport, and the directionality kind of augmenting, with mission ahead. And then when we don't get something right, being comfortable enough and trusting enough to just say, okay, so be it. Let's take another shot at the title.
I appreciate you acknowledging that you're not right.
All the time. All the mistakes are mine.
Well, and I will add one last thing now that I have my wits about me. Also, stay engaged with your supervisors and talk to them about the challenges that you're experiencing. Use the feedback loops that are provided to you, whether it's your one-on-one, whether it's these surveys or anything like that, so that way we understand what's going on, and that's part of our role, is to help remove those barriers, to help guide, to help give you the resources that you need to be able to do your jobs day in and day out. That would be my advice as well.
We have another question.
Yes. So I don't like mics. Yeah. So I've been here with Central for 10 years now. I'm Hector Flores. I'm the IT asset manager, and I've seen a lot of beautiful buildings that are going to come online. It was a challenge to get Capitol Plaza started up since it was a short turnaround. So what is our plan moving forward with all these new buildings coming online? How quickly are we going to go ahead and procure all this equipment that we're going to put into these beautiful buildings?
Can I
All right, so Hector.
Can you please repeat the question so that folks back here can hear you? Stephanie, maybe?
I can. Hector wants to know when his loading dock is coming. And dedicated central receiving and inventory management.
So the question was, my name is Hector Flores. I've been the IT asset manager, been with Central Health now for 10 years, retired military. So I know these beautiful buildings that are coming online also need a lot of equipment installed in them and getting them ready. Everybody knows Capitol Plaza was a quick turnaround. However, that is not the norm, and that would just happen to fall in place because we have already equipment for RZ that we moved into that site to support it right now. But as we continue to grow and continue to get bigger, what is our plan for having that equipment now procured in enough time to have those beautiful sites already set up so when our first patient does go through the door, they see what our vision is in place?
So Hector, I think this is really important. And I think one of the things that we've all talked about is that we do need to do more planning. So there is a group of executives that meets, we call it support ops. So this is something that's come up a lot, is support ops. One of the things that Dr. Lee kind of asked about, and is, I think really, I don't know if it was a suggestion or as much as you being voluntold to do this, is a unified calendar. As an organization, we need to understand, because RZ is opening at the same time as Del Valle probably. So we want to talk about some confusion. Poor Fritz and McKesson is going to just start spinning, right? So we understand, and I think that's one of the things that we'd like to do, especially as we bring on some things that may not have been anticipated originally. We talked a little bit about the CEC, is really try to take a step back, think about what we can do now. Some of it we just have to run with, and I'm looking at Dr. Schalscha. He challenges us every day to just make it happen, right? And I think that we all need to embrace the fact that it's maybe not always ideal, but we're really trying to get the job done for so many reasons. We have a very unique opportunity, and I'll let John and Alan speak to that kind of unique moment in time that we have. But we are going to try to do more advanced planning. I think we also understand that there's a lot of lift from many of you in this room. And a lot of the things, and I think I mentioned this in my presentation, we hadn't thought about. We've never done before. We've never had a courier in-house. We've never had certain functions in-house. Until you came along, Hector, we never even managed our assets in-house, right? So I think that this is something that we recognize as a need, and we are really trying to build some steps to make sure everyone is aware of things and the dependencies that are required to stand up one of these sites.
I could actually just, I'll build on that, and I'll share two metaphors with y'all. So metaphor one is air traffic control. There may have been a time when we could think of ourselves as sort of maybe valet parking, right? We're parking a few cars. If we don't get everything exactly right, the stakes are lower. I think that time is moving in the rearview mirror. We're moving into a phase now already where we are landing planes. If you think about what's required to land a plane safely, not only to get that plane fueled and safely in the air, but back down to the ground safely. That is the work that we're doing. And we need to be able to have those functions to understand that when it's at night and it's raining, we're using the right runways in the right order, and everything is lined up for us to do that. This is not a degree of challenge we've had to take on before. There'll be some growing opportunities, some growing pains as we do that, but that air traffic control function is extremely important as the complexity increases. So that's metaphor number one. Metaphor number two is a funnel. I think Cynthia's sitting over here on this side. There was a point where I was looking at this beautiful and complicated timeline that showed how specialists are rolling out week by week, month by month. And we talked about a funnel with sand flowing through. You can imagine sand flowing through a funnel. What happens if you push down harder on the top of that funnel? The sand actually slows down or even stops. Right? More pressure at some level doesn't help the speed. We have to respect that funnel. Now, we are doing all that we can to increase the diameter and the flow through that funnel, but pushing down harder on the top without actually attending to what's being constrained downstream is actually not the solution. And this links back to Jeannie's point. We all have a role, and to the earlier question from Esmeralda, is that right? Esmeralda, we need your voice, right? Many of you are in parts of the org that are part of that funnel, facilities, IT, HR, compliance, and so on, right? In order for us to land that plane, to open RZ, to open Cameron, et cetera, many things have to line up together, and we need your voice. Speak up. If you see something worrisome, you know, our landing gear is not down, you got to let us know before we're just about to touch down so that we can adjust. We don't have perfect sight. If you are our eyes and our ears, make sure that we understand what you see. That'll help us build this air traffic control function. Think thoughtfully about the pace of sand through that funnel. This is not easy work. This is not the easiest path, but this is the right path. It is our path. And so I'm asking each of you, take that responsibility, lean in, have the trust to speak up and know that we welcome that feedback, and we will do our best to line up these next steps so that we have as few of those sort of last-minute hurry-up drills, which you know are a huge stress on our system and put things a little bit at risk sometimes when we go that fast at the last minute. So just linking those ideas together, and thank you for these questions.
Could I add?
Please.
So, Hector, appreciate you and the question. Want to acknowledge that, you know, I think we really pushed the organization the first quarter of this fiscal year harder than any other time that I've been here. You know, Pat opened up our discussion today with a statement that this was the year to change the narrative about Central Health with our stakeholders and with our patients. And I think we made a decision this year that we were going to prioritize getting services online, even though that meant that we were going to have to activate 2 separate contingencies before we were able to occupy RZ, because it really is that important. You know, we've got hundreds, depending on which specialty, thousands of patients that are on wait lists that have not been seen timely, that have not been given the opportunity for comprehensive care, and I think we have the opportunity to bring that online. So at the end of the day, we really need to deliver on what we said we were going to do so that we have the opportunity to deliver on the next pieces of it that we spoke to here today and that the health equity plan speaks to in a little more detail. I do think we learned along the way. 2 things we learned along the way that come to mind specifically. One is communication. And hopefully today is a step in that direction where everybody's read in on the plan. And everybody can step up and take that responsibility that Dr. Lee just outlined, because now we haven't, you know, just gone through 1, we've gone through 2 clinic go-lives at Central Health, and hopefully as we enter into the 3rd, 4th, and 5th, we're not making the same mistakes, or we're not identifying something, you know, late in the timeline, like we're inevitably going to do for the first go-live. So I think that the second thing I would mention is, you know, we really learned the lesson about contingencies and just the real estate and renovations and contracting environment here in Austin and permitting comes with a lot of challenges, a lot of dependencies and uncertainties. So I think one of the things you'll see us do differently, like we talked about the Clinical Education Center, I think we will plan in advance for contingencies so that that's not a last-minute exercise. It's part of the plan. That we know that we're going to need a bridge site, or we know we're going to need something that helps us get ramped up for a clinic. And hopefully as a result, we have fewer surprises over the course of the year.
Hello, my name is Lynn Bennett. I've been here for a while. I had a question. I did see the name or the branding change and a slight difference in the name from Travis County Healthcare District to now Hospital District. So my question is, obviously that's an indication of what's to come, but do we have a timeline on that?
I think one of the things, thank you so much for asking that question. I think I'd heard some questions when Ted was presenting. I think one of the things, and Ted alluded to this, is Central Health has always been the Travis County Hospital District. For a time, we've used kind of the DBA name around calling it a healthcare district, but we have always been, and we today are, the hospital district for Travis County, Texas, that is formed under the part of the a Texas Health and Safety Code that discusses large urban communities and large urban counties, hospital districts. And we've always had the responsibility and privilege and obligation to ensure that the hospital and medical care is provided sufficiently high quality, comprehensively to everyone. And so as we are going through the next 7 years, building out the healthcare equity plan, filling in the gaps that have been addressed, we are just stepping up and kind of owning what Central Health is and has always been as we move towards being, fully mature.
Do we have more questions? If we do, please raise your hand high, and I'm going to bring you the microphone.
Easy ones, please.
John wants the easy questions. Anybody? If we, no hands, nobody? Over here. Gosh, I walked right. Y'all are making me get my steps. I'm gonna sweat. Who had it? Great, awesome. Thank you.
Hi, Carla Granado with the Navigation Center. So I wanted to go back to something that you mentioned, Pat, about building trust within the organization. And we know a lot of us are mission driven and we're here for the right reasons. But in order for us to take care of our clients, we need to take care of ourselves as well. Yes. So going back to building that trust, will there be opportunities to have more transparency and events like this where we get to hear what other departments are doing and maybe do cross collaboration and just create a more inviting environment where we can know, what is happening across our organization?
Yes. Carla, in a word, yes. Yes, right? The one track and many branches have to come together at so many levels. We need to know what's going on. Even more important than knowledge, I think, is empathy. We need to feel what all of us are doing and appreciate, how many things came into an event like today or into a successful enrollment eligibility moment, into a successful clinical care moment, and really appreciate each other. We're human beings first. If we feel appreciated, we feel seen and recognized, we feel safe, we have a voice, we feel we have a purpose, we're growing, right? We have somebody we respect at work, we connect to, we feel as if this is not only a job, right? Not just a job. This is something that I love to do. There's no other job that I would want to do. That is how we reach our fullest potential. And to do that, we must connect. So even today, as I said at the beginning, is a bit of an experiment. We loved your feedback. We changed this up quite a bit. If I am transparent, we knew we wanted to inform, but we wanted to connect, we wanted to inspire today. And so we shifted our format. I'm sure it wasn't perfect, but we welcome your feedback and we welcome your ideas on how we do this. There's so many ways, from having a 1,800-person kickball game to going to watch a sports event together, to having a holiday party together. I can't promise that we can meet all those wishes, but if you have thoughts on what would allow us to become increasingly one family, then we want to hear them. Right? When you go to the very best organizations, they don't use the word team, they don't use the word department, they use the word family. My goal is to make this feel like a place that you want to use that word to describe maybe your work family, family at work, the family of Central Health. If we're doing our job right, that's how you'll feel. That's how you'll want to speak about this work. And so please help us understand how we do that.
So I'm going to turn the microphone and clicker, by the way, this thing doesn't work, right? We saw earlier, over to Perla. I'm kidding. To bring this all home.
You're gonna let me have it?
Do you want to click it?
Start a love train. So I've got the Bob Dylan voice going right now. I want to say good morning. It's still morning. And I have the pleasure of closing out this meeting. My name is Perla Cavazos. I'm the Deputy Administrator at Central Health. If you don't know what that means, what does the Deputy Administrator do? I work with Pat and the executive team to ensure that the business of the hospital district is getting through our Board of Managers successfully, that our Board of Managers have the information that they need to make the governance decisions that are necessary. I want to shout out to Brianna Yanez, our Senior Manager of Governance, who plays a really important role in that. And I work also really closely with Ted Burton and his team in external relations. There's a lot going on inside. We're growing, evolving, expanding into this mature hospital system. And, you know, just like it's important to relay that to our employees, it's also really important to communicate that to the public, to our elected officials. It's about building trust, communication. And I want to give a shout out to Paul Emerson, our government relations manager, who helps with that communication with elected officials. And there's a lot of them. Really, you know, I want to close out this meeting, and I'll give more thanks in a little bit, but I just want to close out this meeting by giving gratitude and love to our employees, our Central Health employees. You know, thank you for being here. Thank you for the work that you do, for serving our community. The impact that you make in people's lives is so important. That healthcare access, that healthcare equity, you know, the only way we can provide that is through you. We can't, you know, do this without you. Each of you plays a role in the impact that we make. And I want to give a special shout out to some employees that, you know, I think are also unsung heroes. And another one of my roles is to work with the amazing administrative support staff at the hospital district offices at 1111 East Cesar Chavez. If you haven't been there, I hope you get a chance. That's where our Board of Managers meets. I know there's a lot more folks now at airport, but just come by and visit and say hello. We have a really dedicated team that I want to give a shout out to. That's our desk staff and our admin support staff. Laura Cruz, who's at the front desk. Laura, I know you're right there. Christina Flores, who also incredible. Rachel Cortez, our manager of administration. And a part of that, I want to give a shout out also to our security officer, Marie, who I'm not sure, she's probably at Cesar Chavez right now watching the building, but also Nicolas, who helps keep our building clean. And yes, I do, you know, want to give a shout out to Joint Tech because, you know, where are you? Absolutely, we cannot do the work that we do without technology, you know, whether it's Epic or our, you know, meeting now that we have so many staff, we need to be able to run those seamless hybrid meetings, right? In person isn't always possible. And now, as you saw from Jeannie, you know, we're recruiting employees from all over the state and even the country, so we've got to have that technology up and running. And I just, you know, I was looking at my, you know, Ring Central messages, like in the past 30 days alone, you know, I've received help from Micah Witt, Philip Rivas, William Jackson, Will, and then Ismael De Paz, who's here, and I just couldn't have, you know, survived without him, and he was providing a lot of support to Sendero when I was there last year. But really, thank you for all you do. You know, we need you. We appreciate you. It's a beautiful thing to see every day people pull together and unite around a common cause, which is making people healthier. Like Pat said, we are one trunk, many branches. We can and we will make healthcare better for everyone. And as an expression of our gratitude, we will be distributing our new Central Health jackets today. Brenda Ortiz, are you here? Can you come up here, please? And I want to also give a shout out to Brenda. I also want to give a shout out to Brenda because, you know, she was like the project manager for ordering 400 jackets. Again, you know, you wouldn't be getting your jackets today if it wasn't for Brenda. And so, Brenda, I'd love it if you would take a few minutes to explain how we can get our jackets today. Yeah. Oh, yeah.
Can y'all hear me? Oh, there we go. I'm wearing the new jacket. Let's just say I'm very excited to distribute the jackets. I'm done. That was a lot.
She's gonna go on vacation tomorrow.
Yes, Jeannie approved. So as you leave out the doors where you did your name badge, all the departments that you selected on the forms, they're by departments. I know that there were some that selected other, since you didn't know what department, there is a section for that. We do have somebody that, if you don't remember what department you chose, there is somebody that will help you find the department and make sure to get online, get in line. Just please be patient. There is a lot of us. I do have a team of volunteers that, if they can go ahead and step to the tables to start with the distribution. For the remote employees, we will be mailing those in about a week, and I will be in contact with the remote employees. Also, if you were hired after we submit the orders, I will also be in contact with you. So you'll be hearing from me, and like I said, just thank you, everybody that made this process pretty smooth, and be patient with us. We do have a lot of jackets to hand out. Thank you.
Okay, we're not done yet. We're not done yet. We've got one more thing on the agenda. And thank you, Brenda. Yes, we are not done yet. Don't leave. Okay, before we end, there is one more thing we need to celebrate today. Are there any March birthdays out there? Yes, I see one right here. Raise your hand if you have a birthday. I happen to know that there is one person who's celebrating his birthday today, Dr. Pat Lee. And all the today is the day. It's his birthday. But really, all the birthdays for March, we don't want to leave this building without singing happy birthday to you. And I'm going to need some help here because, again, I said I have the Bob Dylan voice going today. So will each of you join me in singing happy birthday to our March birthdays today? All right. 1, 2, 3. Let's hit it. Happy birthday to you. Happy birthday to you. Happy birthday, dear fabulous employees. Happy birthday to you. Thank you, everybody.